I've been asked to talk about chronic pain and treatment for chronic pain without medication. It is very painful to me to realize that my colleagues in biofeedback, which is one thing I do for treatment of chronic pain, do not make themselves known. My professional organizations are AAPB, the Association for the Advancement of Psychophysiology and Biofeedback, and ISNR, which is the International Neurotherapy organization that deals with neurofeedback. And these two organizations have not put the knowledge out there that biofeedback and neurofeedback can help with chronic pain. I have had a number of chronic pain patients where I've done biofeedback, which is training a person to control their own physiology. That's what biofeedback is. It's biological information that is fed back to the person so that they can learn how to control their own physiology. And if you can do that, you can reduce your chronic pain level. It helps the person be aware of their own physiology, for example, relaxing their muscles. And the reason you need biofeedback is because you're measuring the muscle, in this case the muscle tension in terms of microvolts. You cannot be aware of the level of this kind of muscle tension. Microvolts means that it's 1/1,000,000th of a volt. So when you're playing at home and you put your finger into the wall socket, that's 110 volts. Take one of those volts, divide it by 1,000,000, and that's what a microvolt is. In other words, you're unlikely to be aware of the level of microvolts in your trapezius muscles, right, the upper back muscle, to the level of microvolts. If you can learn how to control it and be aware of the relaxation in microvolts to your trapezius, you can reduce the muscle tension in your upper back. And guess what? That can relate to the muscle tension of your neck. And it can control your neck level of microvolts so that you can ease the pain in, for example, neck and muscle, neck pain, and the muscle tension that has to do with headaches. Now, in the case of neurofeedback, this is controlling your brain waves, where you put sensors on your head and you measure your brain waves and you learn how to control your brain waves, training the bad waves down and training the good waves up. And this is displayed on a computer right in front of you, where you can see your level of brain waves going by. Now, these brain waves are then converted into a display, where as the display changes, you can learn how to make the display, let's say, brighter or dimmer as the display goes by. But in this case, the display is any movie you want to watch. So as the movie flickers, your brain learns to control the display of the movie. In one of the examples of neurofeedback, if the display is a movie and there's a auto threshold going on, and as your temperature of your frontal lobe gets below the threshold, the movie stops. Then you focus on the computer bringing up a certain blue bar, and as you go over the threshold, the movie continues, so that you're continually training your brain to enhance its frontal lobe cerebral blood flow, which helps to reduce the pain, let's say, in migraines. So in eight sessions or so, you can actually train your brain to control your frontal lobe cerebral blood flow, so your migraines will go away in about 75% of the cases. Think of that. In 8 sessions, you can get rid of your migraines without medicine. by watching a movie you want to watch. And I have about 150, 200 movies in my office, right in this office, and you can choose which movie you want to watch and get rid of your migraines. Sometimes this is forever. Now it's difficult for me to understand why this isn't very, very popular. But, and it's also likely that insurance will reimburse you for this. Insurance companies will often reimburse biofeedback for migraines and irritable bowel syndrome and some other things, in which training your own physiology is very, very helpful and can get rid of these biological conditions in a reasonably short period of time. So that's some of the ideas about biofeedback and dealing with chronic pain.